First, we want to hear briefly from some of our expert panelists who have joined us today. And I'm not going to further delay any of that because these are the people who really can share with us what we need to know. It's now my pleasure to introduce to you our panelists for today's town hall meeting. Dr. Anthony Brutica, DO, ER Department, Medical Director at Newton Medical Center. And I'm going to introduce them all first, and then you'll each get a chance to speak. My fingers work to turn my page. Francis A. Koch, Sussex County Prosecutor. New Jersey State Senator Stephen V. Oraho. Anne Marie Schaefer, Certified Prevention Specialist, Center for Prevention and Counseling. Erin Kucharski, Advocacy Coordinator, NCADD, New Jersey. Rachel Wallace, Director of Clinical Services, Center for Prevention and Counseling. Each of our panelists will have about 7 minutes to speak with us and share their expertise. And I'm going to start out with Dr. Brutica, if you would begin.
Good morning, everybody. Good morning. Thank you very much. And Sammy, if I'm too, as I said before, if I stay too long, just get the hook and pull me off, okay? So I just want to kind of give everyone a brief update of how we view the opiate epidemic as physicians, and talk about national, New Jersey local, and Sussex County data that might stimulate more discussion about how severe the issue with addiction and dependence and the opiate crisis is in the state and in the region. So I have some PowerPoint slides. You guys all have a copy of there if you want to follow along with me. It's a kind of a green background with some wispy stuff on the side. So opiate overdose deaths in the United States are now being thought of as similar to an infectious disease epidemic. There's an amazing amount of deaths that we're seeing regionally and nationally, and that amount seems to increase every single year. If you look at some of the statistics on the slide, in just 2013, and some of these pieces of data are a little bit older, but they're still very impressive, and they are assumed to be much higher now than they were then. There was 250 million opioid prescriptions written in 2013. That's one for each American over 18 to have a bottle. If you look at how we treat pain medically in the United States compared to other countries, for an example, if you take all of the people in the United States and divide out how much morphine has been given to people in each country, the United States, on average, there's about 663 milligrams of morphine given for every person in the United States. Contrasting that to Japan, which only has about 26.3 milligrams of morphine, and that's in 2010. So this is when we were on the upslope of a worsening problem. And the deaths from drug overdoses in New Jersey in 2016 is over 2,000, killing more people than guns, car accidents, and suicides combined. I added this, I saw this actually 2 days ago, and I added it in at the last moment because I thought it was very important. You know, we as physicians try to determine the average lifespan of the population and come up with a number. And that number is based upon many factors, usually trauma, cancer, chronic disease, and we kind of determine as a whole what the average lifespan of the American person is. And for the last 10, 15 years, that number has slowly gone up and up and up. And now, over the last year or two, it's plateaued, and actually it's started to dip down now for the first time in a long time. And they believe that. So they would say that on average, the opiate problem in this country is taking on average 2.5 months off of people's life. That's just merging everybody as a whole. And the death toll is rising. In 2000 and between 2009 and 2010 in the United States, opiate-related or drug-related deaths overtook car accidents and shootings as the main cause, as a significant cause of death, as a cause of death. And every day, over 90 Americans die from opiate overdoses alone. So if you look in New Jersey, I have a graph there showing the drug overdose deaths from 1999 to 2016. You can see there's a significant incline in the amount of deaths. And heroin-related deaths alone were up 200% in the last 15 years. So some very, very staggering statistics. So I've been in New Jersey about 12 to 14 years. I came here from Pennsylvania. I left my residency in New York and Lancaster, Pennsylvania, and I came to New Jersey. And I've seen significant changes over this last decade. And part of it is due to the worsening, obviously the worsening epidemic. I remember when I was a resident and I came to Newton right out of residency for an interview, and I remember the director at the time saying, you know, every once in a while we're starting to see some people trickle in who might be having issues with pain medicine or substance abuse issues. Well, now it's a daily issue. Now it's multiple patients a day. So it is greatly, greatly increased just since I've been here. And I asked Atlantic Health to give us some data, and I got some very startling figures from our corporate offices that crunch a lot of this data to try to find out where things are happening. And this information is very helpful for us to try to determine solutions to combat the epidemic. If you look at this one table that I have here that says we rank high, just to explain to you how this table is deciphered. This table shows the amount of prescriptions that are opiates divided by the amount of prescriptions total. So what percentage of prescriptions that are given are opiate medications. And then we started looking at areas by zip code. And if you look there, in that dotted orange area, that's our health system's treatment area. And if you look at the very right column, the percentile, 0 being very few narcotic prescriptions, and 100% being the highest amount of narcotic prescriptions in the state, our service area is anywhere between 87 and high 90 percentiles for opiate-related prescriptions. Put that out on a mapped form and find out where are these patients coming from, where do they live? The top half of New Jersey, especially Sussex County, has some of the darkest color associated with patient origin. So the problem is in our backyard, and it's a significant one. So this is where people are coming from. And if you look at the next slide, Newton Medical Center currently has, out of all of the Atlantic Health System hospitals, the highest amount of ED-related opiate visits. Now those are diagnosis codes that have to do with drug, alcohol, or medication-related substance abuse problems as the diagnosis. It's the tip of the iceberg. This is not incorporating people who maybe have chronic abdominal pain or people who may say they have issues that they don't and are trying to get medication while they're in the hospital. This is just a diagnosis of opiate-related issues, and we're currently the highest of all the hospitals. So we thought that maybe the ED is the issue. Maybe the emergency departments are giving too much medication. And ACEP, which is the American College of Emergency Physicians, last year noted that emergency departments, through their studies, are not really the main source of narcotic prescriptions that lead to issues with addiction and dependence. Obviously, they certainly don't help. But the greatest amount of prescriptions right now are thought to come from family practice offices and physical therapy or rehab physicians, rehabilitation physicians. And almost done. And then the other piece of interesting information is on the map of New Jersey, which I have in the previous slide. The black dots represent where these prescriptions are originating from. So you can see there's a significant amount in the northern part of the state, a much more significant amount in the northeastern part of the state. So the bigger the dot, the more prescriptions originate from that area. So what are we doing about it? So as physicians, I can say that we were always told that pain is the fifth vital sign. You remember that probably in the 90s, early mid-90s, that was a big issue. Everyone was telling us, you are not taking care of people's pain, you are too afraid. Pain is the fifth vital sign, you need to respect that. Couple that with a lot of satisfaction-based programs that are in a lot of medical centers, that they want people to leave happy, and a lot of times significant symptom control leads to that, all snowballed into greater prescription rate of opiates. So, Governor Christie signed in the bill to law for limiting the amount of narcotics that we can give patients. And it requires us as physicians to look up patients in the prescription registry program for New Jersey. So we now, every time we want to give a patient a prescription for an opiate, we have to search them. We look to see if they have not had narcotics in a year. If they have not, we can give them 5 days of the most minimal dose possible. A second dose and a second prescription and a third prescription have increasing amount of requirements that go along with it. Third time, you need to be able to put somebody into a pain contract. So in our hospital, it has significantly decreased the amount of opiates we prescribe, significantly. And a lot of times we refer to this law as the reasoning, because we want people to understand what the issue is and why we don't want to get people started, because prescription medications historically have been the main nidus for people to have issues with dependence and addiction. So it is from prescriptions. And Vicodin historically, excuse me, has been the highest medication prescribed next to thyroid medication and blood pressure medication. So we're significantly decreasing that in our emergency department and in Atlantic Health as a whole. We have an ED chair meeting every other month that discusses this, and this is a standing topic every other month, to say what could we do, because we all want to be on the same page. We don't want people to go from one hospital to another and say, well, I didn't get Newton, I didn't get what I thought I needed from Newton, so I'm going to go to Hackettstown, or I'm going to go to Morristown, or I'm going to go to a different hospital. We want everybody on the same page. Okay, so let me just talk really, really quickly about the opioid overdose recovery program, and that's a program that we're doing in coordination with the Center for Prevention, and that is a program now where we put volunteers who have had substance abuse issues in the past right in front of people who will come to the emergency department who are resuscitated from opiate overdoses. It gives a lot more credibility. People have been there before. So we bring these people right to the bedside to initiate a conversation and try to get them to enter into a recovery program. And I was happy to be the first phone call made. I made the first phone call, I think, a week ago for this program. We brought somebody right to the bedside. So they don't want to trust a doctor. They want someone who's been in their shoes. So I think it's going to be very helpful. I'm very excited about it. And thank you very much. And I'll be around for any questions afterwards.
No.
There we go. All right, I am going to ask each of the panelists if you just stay in your seats and speak from there, so we might have any feedback also from our mic. I don't know, the mic isn't really working, is it?
Yeah, it is. Would you rather us there or
It's
not?
in front of me, that's right.
We were supposed to.
All right. We are going to move to our second speaker. And our second speaker is Francis A. Koch of the Sussex County Prosecutor's Office. So I'm going to ask you to speak from there. You do
That's
have
fine.
a mic on. And also I am, just because of time, I'm going to ask you to please all try to stick within your time period. I know it's a lot of great information, but and hopefully some of that will come out in the question and answer period, or if we have extra time. So with that, Francis A. Koch, our Sussex County Prosecutor.
Thank you. I'll try to keep my voice up so you can hear me. Unfortunately, Chief Richards knows that even on a spur of the moment, I can speak for about half an hour on this. But
You
I'll
should
try
run
to,
for office.
Yeah, but I'll keep it as short as I can. And sort of to follow up with the doctor's numbers, how is this affecting Sussex County? We take a look at our overdoses and Narcan deployments. I want to sort of go with those. In 2013, Sussex County had 13 overdose deaths. That number increased in 2014 to 17, 25 in 2015, and 36 in 2016. That's a 176% increase, not in a 10-year or 15-year period, in 4 years it went up. This year in Sussex County, we currently have through August, because it takes us some time to get some of the confirmation back from the medical examiner's office, but through mid-August, we have 21. So we're about on pace probably to do 30, 35 again this year. So are we leveling out? Are we stemming the tide? I don't think so, because you have to look at our Narcan deployments. In 2014, Sussex County joined a voluntary program with law enforcement agencies carrying Narcan, which is the drug used to be able to reverse, at least temporarily, the effects of an opioid overdose. I am proud to be the prosecutor of the county where, and I still think to this day, we are the only county, but I know we were the first, but the only county to have by 2015, a 100% participation by all law enforcement agencies that patrol vehicles carry Narcan to help save lives. Now, by doing that, our numbers have increased. In 2014, again, it was only started in November, there were only 4. But after that, 2015, 47, 2016, 62, 2017, through yesterday, we've had 64.
Wow.
We're on pace to do 85 to 90 at a minimum, and we get spikes. This all runs cyclically. Every now and then we get high spikes, and the same thing with the overdose deaths. Back in April, we had a 5-day period where we had 12 Narcan deployments and 3 overdose deaths. Matter of fact, it caused me to do a press release to the county just to try to get that information out there, because we had what we call a hot batch that dealt with fentanyl, where people were doing heroin and fentanyl was in there and it was causing overdose deaths. So the opioid epidemic in Sussex County, though, is so much more than that. Those are numbers. We have drug crimes, but it's so much more than that, because a vast majority of our property crimes, whether they be burglaries from homes or cars, whether it be thefts, whether it be shopliftings, all those crimes are done to feed someone's substance abuse disorder, almost all. That is the predominance. So we as law enforcement, if we can do more to eliminate that up front, we will make Sussex County safer. And that is the reason law enforcement is so tied into this and is so behind it. Talking about growth, I don't know if anyone saw, but this past week, New York City, and most of the heroin we get is either from one of the cities in New Jersey, but New York City had a bust where they took a bust of 75 pounds of heroin and 140 pounds of fentanyl, and fentanyl is a synthetic opioid. If you break that down, that's enough to make over 1 million 30 milligram bags of heroin or over 63 million bags of fentanyl. That's in one bust that gets distributed. So that comes to Sussex County. So what are we doing in Sussex County? How are we trying to address it on multiple different phases in different areas? First, in the criminal justice system, we have drug court, where people that are charged with crimes, if they are found to have a substance use disorder, they're offered the opportunity, and now there's some mandatory since July where it became mandatory, to get into drug court. That's anywhere from a 3 to 5 year period. Most people are 4 to 5 years of probation, where they're overseen by specially trained probation officers, prosecutors, and the court to ensure that they get into rehab, that they get sponsors, they find jobs, and they become able to then face their demons of this and come into society and become productive workers, become productive members. Some of them have now moved on to become some of our recovery coaches. It's a phenomenal program that we need to celebrate when someone is able to go through this recovery. For those who are distributing drugs or committing other serious crimes, prosecutor's office, law enforcement will always be there to charge those, and they will be dealt with appropriately. Some say prison terms, some very long, but that is a very important part. It cannot be just one or the other, but we will not arrest our way out of this issue. The CLEAR program, again, a program that kicked off last July with Newton Police Department. The prosecutor's office is 100% behind it, the center, and we worked out a program where we're trying to get people prior to having criminal offenses to be able to turn themselves in, come see a police officer, get a coach, and get into recovery long before they meet me, long before we have to bring them to court and spend all those funds and get them into counseling. As was just mentioned, the joint venture this year just did it with the emergency room so that we can now get coaches directly there, so that we are able to meet people maybe at their lowest point and a point when they're able to reach out and need that help, and their family members, because we're able to speak. We have coaches that are meant solely for family members to help them learn some of the signs, coping, and get that person into rehab. And just 2 days ago, the Sussex County Prosecutor's Office and the chief, they held a meeting where we have 6 additional departments now in Sussex County that will be receiving agencies to be able to refer people to those coaches. And those towns had officers there for training. That included Vernon, Hardiston, Franklin, Sparta, Byram, and Andover. Union County has now followed us in our CLEAR program. Just 2 real quick things. The Opioid Overdose Prevention Act. It's an act that's passed under our law that if someone calls for help for someone who's in the throes of an overdose, that person, if they have drugs on them, and the person who is doing the drugs, they're not getting charged for those crimes. And that has to be known by the public. The purpose there is to save their lives and get them there. Not to be afraid if I call and the police come, I'm going to allow someone to die. We cannot allow that to happen. Finally, we need to change the dialogue. We need to get away from stigma and condemnation and get to a public acceptance that this is recovery, this is hope, and something to celebrate. Our legacy should be that we're bringing hope to those in the throes of their substance abuse disorder and their families, and we're giving them hope. And by doing that, we'll make Sussex County safer, more business friendly, and a better place to raise a family. Thank you.
Thank you, Francis. All right, our next speaker is the New Jersey State Senator, Sorho.
Thank you, Tammy. Can everybody hear me all right?
Sure.
Okay. Well, first of all, I want to thank the Center, and I want to thank you all here for being here. Since I was a freeholder, I think I've been involved with the Center for Prevention and Counseling with their the issue of underage drinking, with respect to the whole drug issue, and they do a fantastic job. And I want to thank you all for being here because it's the education that we get here as legislators. Actually, the doctor and the prosecutor already took some of my presentation, talking about some of the legislation we've done. And I'll talk about it just briefly, I'll stay with my time limit too, because as an elected official with a microphone, that's tough, right? But the education that we got in talking with parents is critical. And the education I hear today is critical because it does help us shape how we can help the community. So just real quickly, I just want to go over some of the things that what the legislature's been focusing on. It's the prevention to discourage the abuse and limit the unnecessary access to opioids. You heard the doctor talk about that. Improving emergency treatment and long-term recovery. And then the criminal reforms to more effectively punish dealers and not those who need treatment. When you look at the prevention, the doctor already spoke about the issue of the opioid abuse, and I was amazed when I found out that you have things called skittle parties or bowling parties. And that's where they take them and put them into a bowl, and the kids will go in and take them and just pop the pills, not even knowing what they are. Because of the Center for Prevention and Counseling, and the prosecutors, I was able to talk about that down in Trenton. A lot of us didn't know about that. They're actually Skittle parties or bowling parties. The issue of doctor shopping, the prescription monitoring program itself. I'm pleased to say I was actually a sponsor of that prescription monitoring program, and I'm very proud of my daughter Kathleen. She's a doctor of pharmacy, and she would tell me when she was going through Rutgers, some of the things that they were seeing then, and now she's a practicing pharmacist, and she's telling me that some of the things that she sees there and their responsibility as pharmacists and the time the shopping that she sees. Now in the prescription monitoring, we now have sharing our data in New Jersey with 12 other states. All right, so we're trying to broaden this throughout the country. It's something for the prescribers, the pharmacists, as well as the emergency rooms, as the doctor had mentioned. The issue of the Project Medicine Drop, where we're trying to widen that throughout the whole state, where you can come and expired or unused medicines and drop them off at your police departments. And so many of our police departments here in Sussex County already have those where you can drop them off, because that's where they go. They go into your medicine cabinet and you're not expecting it. And I will tell you, me personally, when I had knee surgery, I took one of the painkillers. I did not want to take any more. I still had a supply, and it sat in my medicine cabinet, actually my kitchen cabinet, for probably over a year. That's horrible. So everybody take an inventory of what you do and bring them to your police department and get them thrown out. But I will tell you, I was the only one to take one out of there. So the other thing is stopping the over prescription, and the doctor went through it. I know the prosecutor went through it, so I won't say it. The bill that was passed and was overwhelmingly passed, and it's because of what you all doing here and the Senator's doing of educating the legislators and your freeholders of what you're going through. So I would have never really thought about, and Dr. Bonet, J.P. Bonet, had told me, he said, Steve, he said, when one of my sister had gotten a prescription, 60 days, she was going to, he goes, you take that 60 days, you're hooked. And the issue of the 5 days or 7 days came from talking with, prescribers. Some of the things, prevention. Youth programs to get them doing other things, and something I was very proud of as well. And it's just one program right now, and that's the Hooked on Fishing, Not on Drugs, to give them something else to do. And the sportsmen and women have gotten very much involved with this and bringing it into the schools. We actually did that in 2012, and I was very happy to be part of that. You heard all about the Narcan. We actually did have to allow that to be used and given now, and quite frankly, we've tried to even expand it. I think even trying to get it expanded into schools, but now many first responders carry Narcan, and I think what we did is we allowed it to be sold over the counter as well, and that was part of the bill as well. The issue of insurance, the bill that was passed. One of the things we hear way too many times is the treatment programs are way too short, and there needs to be more time. The insurance companies be 30 days, and what I keep hearing is most time they need at least 90 days. The families have to be involved, and there has to be monitoring after. That's the three keys that I keep hearing for success, and I'm glad to see that the governor as well as the legislature got on board to make sure that it got extended. The other thing is the Reach New Jersey. One of the things, and it's please on a website, you can go right there, it's Reach New Jersey. Where are the treatment centers? Where are the beds? And when people would come to my office, we didn't know either. So one thing we did, we went back and worked with the administration. There is now a portal, and it's required for anybody who has a treatment center or a bed available that they will report it back to the Department of Health, and that will be on the website, all right? So Reach New Jersey, you can take a look at that just go right in through the New Jersey legislature or the governor's website. All you got to do is if you Google Governor Christie, it'll come up. All right, I guarantee. And if you Google my name, it'll come up. Other things will come up too, but so please use that as well. And right now, I'm hoping I'm okay. I'm okay on time. All right. And then the issue of stopping drug traffickers. As the prosecutor said, let's get the treatment for those who need the treatment, but also the drug traffickers, we're going after you. And not only, and the issue, and the prosecutor came to us with an issue with respect to an effort to allow the prosecutor to charge drug dealers based upon dosage units and not on the weight. And when Francis came and spoke to us about that, we couldn't make, there's a bill going through to make sure that, see if that will carry through and actually happen. But it's through the discussions that we've had with all of you, our prosecutors, our law enforcement, the center, because I'll tell you what, every legislator thinks that they're the smart person. We're not. Listening to what you're going through every day, that's how we can be mostly effective. So please don't think that we know all the answers or how to get something done. It's through you that helps us significantly. All right, thank you.
Thank you, Steve. We heard from Dr. Brutico on the public health issue and Prosecutor Koch on the law enforcement perspective on the opiate epidemic, and our senator on he and his colleagues in the legislature. We're now going to move to Anne-Marie Schaefer, who's going to talk to us more about the role prevention plays in addressing this epidemic.
Thank you, Tammy. Welcome, everyone. Thank you for coming. I'd first like to say I've been a resident of Sussex County for a little over 30 years. Back in 2008 was when the Center for Prevention and Counseling, through school student surveys, noticed that 2 years prior, in the present year, in 2008, there was a 40% increase due to student surveys who reported using prescription medications and stimulants recreationally. And that stood out to us at the center, them at the time. I wasn't there. But it was in 2008 that I became a volunteer there because of what I saw was happening and understood from them through those school student surveys that we needed to do something. And what I learned and what I hope to convey to you today is how to get involved with prevention. Throughout the state of New Jersey, there are, in every county, prevention agencies that host coalitions monthly. These meetings are open to every sector. Every part of the public is welcome and needed to address this. In Sussex County, what we have done to address the prescription opiate epidemic through the coalition's work is monitor, secure, dispose, and talk. What you heard about the prescription drug monitoring program in New Jersey works when physicians sign up, and as of March, it's mandatory. So in order to renew your prescription to prescribe controlled dangerous substances, you do need to be registered with the program. What our agency director realized was that there was kind of a problem because you need to have your paperwork notarized as a physician. Becky went and became notarized so that we could offer these workshops to physicians and immediately notarize their paperwork so that they could be registered. And we continue to have those events with pharmacists who are our frontline gatekeepers. And I have to tell you, in Sussex County, our pharmacists are the ones who are calling us, who are very, very proactive, and they are bringing attention to many problems when they are there. We host pharmacy workshops on Sundays because that's when they're most available, and they've been very successful. Medical professionals as a whole, the Partnership for Drug-Free New Jersey hosted last year here the Do No Harm workshop. They are doing that throughout the state as well. Do No Harm is for medical professionals and brings to light the CDC guidelines and better prescribing methods for opioids. That's your Monitor Secure prescription drug monitoring program. Unfortunately, that prescription drug monitoring program doesn't work on fentanyl and the black market drugs, but it does work when doctors use it. What I suggest that you do, if you use a physician, ask them during your appointment, are you registered with the prescription drug monitoring program? Show them that you're part of the solution and that you hope that they are as well. As far as securing medications, Don't put them in medicine cabinets. We teach funeral homes and realtors. Help your clients know, a medicine cabinet is no longer a place to put your medicines. Secure them and dispose them. 8 local police stations throughout Sussex County have 24/7 access to prescription drug disposal sites, as well as on October 28th and in the spring, fall and spring every year, there is a highlight and promotion to help people understand the disposal of prescription drugs all year round. Coalition membership, like I said, we are there every month hosting a meeting. We hope that you will, we heard from Governor Christie on Tuesday, the day of passing out papers and pamphlets is over. And I think he's right. Social media, that's where people are. We need you to go online at CFPCNJ, find the Sussex County Recovery Community. These are places you need to share. We don't have the budgets that Budweiser and Marlboro, we don't have the marketing and the agents to dress us and do this kind of production every day. We don't have those budgets. We need the public to be our marketing agents. So please share our information on Facebook whenever you can. And on October 6th is Knockout Opiate Abuse Day, an initiative started last year, again, by the partnership. It's a grassroots effort. There's materials here. Volunteers walked into doctors' offices last year. They will again this year. Doctors' offices, schools. We had somebody putting the door hangers on every apartment complex, every building and apartment complex, because parents didn't understand the connection between prescribed opioids and heroin. One more thing, the adolescent brain, we know so much more about it today than we ever did. And that's what I need parents to understand and how we do help them understand. Prescription pain medications, especially when prescribed to those under 18, are very highly associated with addiction later in life. So the more we can get youth, like you said, underage drinking, no matter what it is, more we can push youth towards 21, 25, 30 before they ever start a drug, it's the more we likely stave off addiction. And I think I am done. I'm really proud to be part of the agency now. I went from a volunteer 8 years ago to an employee for 7 years, and I am actually a family recovery coach as well, and really excited to help families understand, reduce the stigma, which Aaron is going to talk about, but I think I'm probably done. Thank you very much.
Good job, Anne. Well done, Anne-Marie. Well done.
I'm now going to introduce Aaron Kaczarski, Advocacy Coordinator, NCADD, New Jersey. Aaron, can you tell us some of the barriers to recovery? For example, what role does stigma play in this epidemic?
Yeah, good morning, everyone. Is my microphone's on? I'm trying to figure out how loud I need to speak, because I have some stuff to say. So, besides being a coordinator for advocacy across the state, I'm also a person in long-term recovery myself. September 6th, 2003. I don't know if people realize it or not, but we're in the middle of Recovery Month, September's National Recovery Month. So it's okay to speak out, all right, and to talk about recovery clearly, to be talking about the solutions, because if we're losing 90 to 130 people a day from overdose in this country, that's not acceptable. And so we can, and so when we bring together solutions in the community, and I truly believe that it's about the community solutions when you look at what's happened in different communities in Sussex County to respond to the opioid epidemic. You need law enforcement in the room, you need the prosecutor's office, you need the legislature, you need recovery advocates, you need family advocates, and you need clinicians. It's an all hands on deck sort of approach to the solution to this, because guess what? The drugs are more powerful than all of us. And talking about the barriers, I was asked to talk about the barriers and the stigma, and I was thinking about this girl that I met 2 days ago in a neighboring county, but that's irrelevant because people are struggling everywhere. She's 25 or 26. She suffers from seizures, right? She's on anti-seizure medication. She goes to outpatient, drug outpatient a couple times a week. She doesn't have a home. She's in between two friends' couches, right? She goes from one couch to the next couch. She doesn't have any money. She has been eating yogurt and fruit for like a month. And whatever extra food she has, her dog gets. She's on Medicaid. And so when I think about the barriers, it's not just how strong the drugs are. People think that recovery is about stopping drinking drugs, and that's it. It is not that simple and boiled down to just that. She's 150 days in recovery, stay in recovery. She just got a job, right? Like, things are moving, but it's hard. And every single day of her life, she's trying to stay alive and to deal with life without the crutch of a drug that she was dependent on for so long. And you throw in mental health issues in with that, and the housing issues, she's up against a lot. But she's 151 days without a drink or a drug. And so the point is that the people that are struggling with addiction and the people that are working to sustain their recovery, like I'm 14 years into this recovery deal, and I'm still working on stuff every day. And that's the beauty about it, is that when we can get people healthy and we can give them the tools to maintain their recovery, and we have places like this, like a peer recovery support center in the heart of the community that is, right down the street from the liquor store. We need that. That's the culture change that we need in the communities. And we're all a part of this. We're all sitting here for one reason or another. You might have a family member, you might be recovering yourself. We're all tied to this. And so collectively, we need to be thinking about solutions and stepping up our game. Because again, 90 to 130 people dying a day is not acceptable. Think about the amount of people that have died since I've been talking, and I've been talking for 5 minutes. And that's heartbreaking. And the last barrier that I want to talk about, and a couple of the panel members touched on it too, the fact that we are the most overprescribed country on the planet is a barrier to for people wanting to get help. The drugs are out there. We're not just talking about illegal drugs. I talked to a father the other day that his daughter, she got her wisdom teeth taken out. She's 16 years old. And she gets written a prescription for 30 days of medication. So think about that. You get 30 days of medication for maybe 5 days of pain, or who knows. I don't know. But the point is, there's going to be some extra pills in that house, right? Yeah. If they get that prescription filled. And so the father asked the dental office, why are you giving my 16-year-old daughter this amount of pain medication? And the answer, and this is what blows me away, and this is probably a common answer, they said that is the standard amount. Let that sink in. That's the standard amount. Like, no matter how old this person is, no matter if this person had a history with addiction before or not, you wonder why this opioid epidemic is affecting young people the way that it is. It's not by accident. Young people's brains are still developing, right? There's not a culture that supports recovery for high school students or middle-aged students. or collegiate students for that matter too. I mean, so when I'm talking about solutions and culture change, it's changing how we look at how this is affecting our community, because we can make our community welcoming to solutions and recovery, or we could not, and see the consequences of untreated addiction continue to take over. And so, you know, the stigma piece to this is when you think about that girl I was just talking about, the 25 to 26-year-old girl. When you look at her and you think of that person as less than, or they don't deserve another chance, or they did this to themselves because they're doing drugs. This is a human being, all right? And this is a living, breathing human being that is struggling. And her family is struggling. It's not just people, individuals. It's a whole families, affects entire communities. And that's why there's family members in here. And there's a stigma for family members too. Like, somebody's using drugs, oh, the parents must have did. No. Nope. Addiction will affect anybody. Doesn't matter how old you are, what race you are. It's gonna hit your community. And we can do things to prevent it, and we can do things to recover from it. But we have to really start looking at people like people, and not for the drug that they're doing or the mental illness that they might have. It's the third time I've seen that.
Yeah. Thank you. Thank you, Aaron.
Thank you.
Thank you, Aaron, for sharing the real life scenario.
Oh, yeah.
And a real picture of the stigma as well as the process of recovery. We're now going to move to Rachel Wallace, Director of Clinical Services here at the Center for Prevention and Counseling. And Rachel, can you tell us what type of barriers occur when someone's seeking treatment and what they can do to get help here in Sussex County?
Yes, thank you, Tammy. So many of the presenters touched a little bit on the solutions, and we've been saying from the first meeting of the CLEAR Steering Committee back in November 2015, several of whom are here today, that a community problem deserves a community solution. And everybody here today is proof positive to that. It needs multidisciplinary team to address this issue. There are, law enforcement has a strong showing here today, indicating a commitment to not just enforcement, but more importantly, embracing recovery as an option for individuals. And they've taken the time to get to know people in recovery and what that looks like, which is much different than those who are suffering from a devastating illness that science has proven exists in the brain. But unfortunately, it's an illness that leads people to desperation and which leads to some of the stigma. We know that the science explains behaviors. It doesn't excuse behaviors. And one of the things about recovery is personal accountability, and people become productive members of society. They're employable, and they become advocates and champions for recovery. So a huge barrier is funding and availability of resources. Senator Orville mentioned Reach New Jersey, and that is an excellent resource to find out where there are beds available. Unfortunately, many of those beds are for individuals that have commercial insurance only. And this illness impacts young adults, many of whom are covered through their parents' insurance through the age of 26, but oftentimes people that are in need of treatment for an opioid use disorder do not have insurance, or they have Medicaid, and their options become more limited in New Jersey. When you go to the emergency room and you have an injury, you're never turned away. You're given what you need. Unfortunately, with this illness, when you need help and you seek help, sometimes you're told to call back tomorrow because we don't have a bed. What we know about people who are progressed in an opioid use disorder is what that means is that they need to continue using. or they're going to experience extremely painful withdrawal that drive them to continue to use. With alcohol use disorders and those addicted to benzodiazepines, that's a potentially fatal withdrawal. They need medical assistance. They're told to call back tomorrow, or we have a bed for you in 5 days. So just make sure you get here that way. And then you have to try and find transportation there, which is very challenging. In Sussex County, there are many options within Sussex County to get where you need to go, but then when you need to travel out of the county, your options are very, very limited. The lack of availability of medicated assisted treatment also contributes to the struggles with individuals seeking treatment. Again, this is a medical issue, and with other illnesses and medical problems, there are FDA-approved medications that can support and assist people in seeking abstinence and then achieving long-term recovery. And oftentimes they're, again, without resources, without private insurance, it is almost impossible to access those services. There's also a stigma associated with the use of medicated assisted treatment. And while there are some prescribers and some patients that have contributed to that stigma, overall, there is research, and I can tell you many, many anecdotal stories that it works. It helps people to reduce their cravings, to help them not use long enough that brain that has been deranged because of the tissue changes as a result of addictive illness can start to heal. And people can start to, again, address all of those other issues. As Aaron said, recovery is more than just stopping the substance. There are many, many resources, and so many in Sussex County as well. And I'm proud to be an employee of the Center for Prevention and Counseling that offers so much for the community. Well, I want to start with the family because there are many family members here, and family is greatly impacted by this illness as well as the communities. We have a professionally led support group for families funded through county dollars at our main office on Spring Street. And we also have, run by Anne Marie Schaefer, a CRAFT, which is the Community Reinforcement and Family Training Group. It's a different approach to helping individuals who have a loved one who has a substance use disorder. By the way, 21 million people are diagnosed with a substance use disorder in the United States. That's 1 in 7. So look around the room. You know, it's your children, it's your parents, it's your neighbors, it's your family, it's your friends, it's you. And that we know that as many of those individuals are also seeking recovery and are in recovery. So the recovery community is huge. The overdose deaths, it was touched upon, drug overdose in the United States, 144 a day. If you add alcohol into that, it's 375 a day. Let's not forget how devastating severe alcohol use disorders can be. It's a slower, more prolonged, painful decline. That's 375, and as Governor Christie mentioned recently at a press conference, over 3 weeks, that's another 9/11. That's 3,000 people. Every 3 weeks, the opioid and drug and alcohol epidemic in the United States is another 9/11, and we need to stop that. The governor is calling for $200 million in funding, immediately implementing 21 new initiatives in the state to assist those that are in need, including incarcerated individuals. It's like we've got this captive audience, right, that we can provide treatment for, but because of some of the licensing regulations and things of that nature, we can't get in there to do that. We're in Keogh Dwyer providing life skills to individuals who are incarcerated, but we can't do treatment, you know, because you got to have a license to go in there and do treatment. So they're really looking to address that. Initiatives including pregnant women. You know, when the brain is hijacked, that drug takes over your basic instinct and survival skills, including caring for your young. It is not because they don't love those babies. It is not because they're a terrible person. It is because their brain has been hijacked and the drug is about survival. They need and deserve support, as well as the children that are born experiencing neonatal abstinence syndrome. I'm at 0, so I just want to tell you, at the Center for Prevention and Counseling, we also offer outpatient, intensive outpatient, assessments, evaluations. early intervention for adolescents, because the earlier you identify the symptoms of this illness, the better the outcome. Why do we only have one kid in our intensive outpatient program when kids are dying every day? Schools have to stop being afraid to make a referral because they're going to show up on the list in the paper once a year as having a drug problem in their school. It's not a problem, it's that they care and they're concerned about getting kids into treatment. Capital Care is also in the community, provides transportation for people that don't need it. I don't know if Dan made it here today, but all I want to say is if you're seeking treatment and you're having problems and you can't find any solutions, just call me in my office, ask specifically for me, Rachel. It may take me a day or so to get back to you. If you say it's an emergency, I'll find the time to get back to you immediately, because we never want someone to feel like the phone's been hung up and there's no options, because there are many, many options. Recovery supports is the way to assist individuals that don't have the luxury of 90 days in treatment. This community, the recovery supports are strong. Aaron has helped lead our recovery advocacy group that's now self-sustaining and doing wonderful things. Katie Kalbaka can tell you more about our recovery supports. And we believe that every life is worth saving, and that it just simply starts with a call for help, and we want someone to be able to say, I can help you. And at the Center for Prevention and Counseling, we look forward to continuing to serve you, your family, and community.
Thank you, Rachel. All right, I want to thank our panelists for sharing their knowledge, and I'm sorry we had to cut you short at some point, but there's only so much time that we can ask our audience to stay. We are now going to ask and introduce our sponsor for today's town hall meeting, Horizon Blue Cross Blue Shield of New Jersey, Florence Kariuki.
Can you hear me?
Yes.
So good morning, everyone. My name is Florence Karaoke. I'm a registered nurse. And as Rachel mentioned, I worked as a nurse taking care of little babies with neonatal abstinence syndrome. So this is very close to home. So I'm here representing Horizon, but I just want to mention that I have worked with babies, and just seeing babies in this state really brings this close to home for me. And so this is a really meaningful event for us to be here together. It is my pleasure to be here representing Horizon Blue Cross Blue Shield of New Jersey. And as the state's largest and oldest health insurance, Horizon is dedicated to improving the lives of all New Jersey residents. That is where we are proud to sponsor today's town hall and many others such as this that are continuing to happen across the state. Since its inception in 2004, the Horizon Foundation has awarded more than 1,300 grants and more than $49 million in support of nonprofit organizations that have improved public health and the quality of life in New Jersey. The grant being used to sponsor this town hall series is as important to us as the grants that we've issued in the other over the years. And as we've heard from our panelists today, New Jersey has the highest rates of opioid addiction, having claimed over 5,000 lives in the past decade, with more people dying in New Jersey in 2016 from drug overdoses than from guns, car accidents, and suicides combined. According to the Office of the New Jersey Medical Examiner, there are between 2,090 and 2,250 drug-related deaths overall in New Jersey in 2016, up from 1,587 in 2015. New Jersey also has the 6th highest in the nation rate of visits in the emergency room department. I think the doctor mentioned that before, due to opioid abuse. And naloxone, or Narcan, as you've heard before, a medication designed to rapidly reverse opioid overdose, has been administered over 25,000 times in New Jersey since 2014. So today, again, as you've heard, drugs like fentanyl and opioid up to 50 times more powerful than heroin, which is killing in New Jersey residents at a rate that is tripling yearly, is continuing to get out of control. So in 2015, 417 New Jersey residents died from fentanyl overdoses, up from 42 just 3 years before. So we know how important addressing this epidemic is, and that is where we as Horizon Blue Cross Blue Shield are really committed and determined to help knock out opioid abuse in New Jersey. We are committed to collaborating with thought leaders like the Partnership for Drug-Free New Jersey to address our state's opioid issue and to support the health and safety of New Jersey residents through public awareness, education, and the identification and dissemination of best practices to combat the opioid epidemic. So in fact, and I speak this personally because I've been involved in this, we already have several programs and initiatives designed to help ensure members and their doctors make careful, informed decisions regarding availability treatment options. We have meetings across the state, and I see some members from Horizon here. We meet with hospital leaders and we think about clinical programs and innovations that we can set in place, really because we want to put actionable solutions into the community. We provide our network doctors with comprehensive, fact-based, and actionable risk reports in the dangers of prescribing opioids. Our pharmacy team also uses tools to predict future probabilities and trends of misuse and abuse to educate healthcare professionals about their own prescribing behaviors and the patient's risk behaviors. In short, our programs help our members and prescribers take responsible actions when considering the use of opioids as part of a treatment plan. So we thank the organizations that are collaborating with the partnership to present in this town hall, and each of the panelists that spoke really eloquently. So thank you so much. I took a lot of notes. I thought that was really good information. We also thank the panelists for helping us understand the gravity of the opioid epidemic within our state. We thank you for sharing some very specific interventions, such as the Opioid Overdose Prevention Act, the web portal, Reach New Jersey, prescription drug disposal sites, and just many other things that I'm not going to go into, just not to be redundant. And we also now know how we can all work together to lower the rates of opioid prescriptions, reduce opioid addiction and overdose, and to improve health outcomes for those receiving treatment for opioid abuse. And so on behalf of Horizon Blue Cross Blue Shield, I thank you all for attending to this very important event.
Thank you. Special thanks again to all of our panelists here today. We are now going to open up for comments and questions. I am going to ask you to keep the answers as brief as you can so we can answer as many questions as we can. And certainly I'm sure that our panelists and others will stay after to talk a little more with you if you have additional questions. We have a microphone ready. You're set. And I know there was a hand first. One of our freeholders started raised his hand before the question time. So.
Thank you. It's not so much a question as there are 6 chairs here, but there are a couple of other components to the overall picture. I noticed the word actionable was used repeatedly. Christine, you're going to be up on this one, so get ready. The county is a very big part of this. The county, either through funding or through people that are coming through. Chief Richards, he sees people in law enforcement, they see people coming through in their direction. Center Prevention sees people coming through their direction. Through social services, human services, the whole HSAC, Human Services Advisory Committee, we see things in many other ways. Yeah. I'm going to hand the microphone over for a very short moment because I think Christine Florio can give you just a few things that the county's involvement so you don't have to put a chair up in front.
Very good.
Just say a few things where we are.
Okay.
You're on the spot,
Yeah.
Could
Well, in terms of the early intervention, I know that we touched on that and Rachel touched on that. One of the things we're looking at the county level is we have a Right Path suspension intervention program, which basically we're allowed to use our county contracts, which one of them is with Center for Prevention and Counseling, which is a substance abuse contract, and we also work with the local agencies. So we're working with all the schools and the police departments in the schools and really identifying children earlier and then hooking them up to our services that is free to the family. So we have funding through the county. The families do not have to pay for the services. It's really just working with the schools and the police departments. So we're also working on a station house adjustment program as well through the police departments. Thank you, George, for allowing me to talk for a minute, and everyone. So I know Chief Richards has been very supportive. Francis, our prosecutor, has been very supportive of this. And we're actually having a big event in November, really kicking off the Right Path as well again, and the Station House Adjustment Program. So the county is very committed to working with all of the agencies, and honestly, Center for Prevention and Counseling is one of our biggest collaboratars. So it's wonderful to work with everyone. But yes, we are working on a lot of initiatives at the county level. We also have contracts for our adults as well. And Nick Louisi, who was here, he's our county coordinator. We do have a lot of contracts in the county to help people who don't have, who cannot pay for treatment. We work with Turning Point. We work with Center for Prevention and Counseling, Capital Care, Daisy. So we have a bunch of county contracts as well on the adult side.
Christine, one more thing, municipal alliance.
Yes, we also have our municipal alliances, which are prevention. So every municipality, most of the municipalities do participate. We provide over 90 prevention programs each year to the municipality. So if you'd like to get involved, you can always let me know. Thank you.
Good job.
And thank you for bringing that up.
So I
Yes.
don't have a mic, it was,
You have my name.
I have to talk into Aaron, I have to share Aaron, it's to his chest, so. And thank you, Christine, because I actually had that on my notes about funding, but I got a little caught up. Don't let funding be a barrier. If you don't have funding, if you don't have insurance, just call us. If we can't help you with the grants we have through the county, through the state, et cetera, we will find a place for you to get the help that you need. No Sussex County resident will be turned away because they don't have funding or insurance. You might have to wait, but we're gonna get you supports with peer recovery specialists and coaches in the meantime, so you can get that bed that you need or the treatment you deserve.
Wonderful, thank you. Another question? Yes.
The lady over
I'm going to ask you to talk into the mic so that we have this.
Hi, my name is, it's not Maury. Oh, there we go. Hi, my name is Nicole. I'm the alumni coordinator at Sunrise House. And one of the things that I realized, because I'm also a person in long-term recovery, so basically what I...
Congratulations, yeah.
So really what I focus on, like I have the gratitude of being able to have a position where I get to do what my program of recovery has taught me, where I get to help people leaving treatment and guiding them along their path of recovery. My issue is for like the hospitals, and that's really where my question's kind of directed to you. Sorry, several times in personal situations with people in my friends or my networks or family members even, as well as my alumni that I've had to try to support to guide them through readmission or anything like that, is really the identification and training of some of the staff at the hospitals. I've had situations where I had an ex-brother-in-law that passed away from this disease, but the first time he overdosed, I went in trying to be like a recovery coach before this even happened. This was about 1.5 years ago, and I walked in saying I want to talk to him about treatment options, and she turned me away from Hackettstown Hospital, stating that, do you even know what recovery is about, because now's not the time. It was just that identification, and 2 weeks ago I dealt with another alumni who overdosed in the Sussex County area. I brought him to the hospital to take care of him, trying to get a readmission. We sat in the hospital for almost 9 hours waiting for mental health to come screen him while we were taking care of the opportunity of getting him readmitted into somewhere else. And it's just these kind of barriers where, the nursing staff, so they weren't allowing more than just myself. We had a room full, like a waiting room full of people from AA and NA there to support him, and they weren't allowing more than like one person at a time to come and talk to him and support him. So it's just, sometimes I feel like there's more barriers with just the staffing, the educational, understanding recovery and addiction, and maybe if there's anything that we could maybe help with that with the community.
I'm going to ask if you'd like to respond a couple
Sure.
minutes, and then certainly if you want to stay
As
after.
as far as, I can, being the chair at Newton, it's not always easy for me to answer for other hospitals in the system. But I do know that that's the kind of feedback which I can bring back to our ED system chair meeting, which occurs every other month. So if there are issues like that, I have a very good working relationship with the director of that ED, who can pass that along to the nurse manager to make sure that we have the nursing staff trained appropriately on how to handle patients, families that surround the issue with any type of overdose or substance disorder. And at Newton, I can tell you that we have trained most of our nursing staff on how to be more understanding to the care, because a lot of times a lot of ED people are very hardened over the years, because we see a lot of different personalities, some more difficult than others. And we just have to keep reinforcing that this is a disorder, this isn't just a personality issue. And sometimes it can be patients who can be a little bit forceful in one direction with how they interact with our staff, or sometimes it's family. But I know at Newton that we've had a lot of training on that. As far as mental health, I know that that's an ongoing issue. We have a huge mental health component in the county, and Newton is one of the only hospitals that in the region that has inpatient mental health services. So we get a lot of volume of patients. So as much as we'd like to get people seen and evaluated very quickly, we also don't want to do things haphazardly and quick just to make the times appear shorter. I see Paul Burns is here. Do you want to speak? You want to speak on that? Paul, you want to talk on that a little bit about evaluation?
Oh, I apologize. My name is Paul Burns. I'm the coordinator for the Mental Health Screening Center at Newton Medical Center, and now the crisis coordinator at Hackettstown Medical Center. So I know Dr. Brudico touched on it earlier, but speaking to what you're saying about the time, that's a fact. And some of that is because we may have high volume, and we may want to be working with the folks that we're working with and give everybody their due time so everybody gets what they need. And that can take time, hours even, to achieve that. Just to address the one point. But as I know Dr. Brudico spoke earlier, I do apologize, I missed the beginning of yours. That we've developed this relationship with the CLEAR program and the Center for Prevention to bring in the peer recovery specialists, and that's happening on the spot. They're using the hospital's red phone, which goes directly to the police department to activate a recovery coach. The hospital has initiated the recovery coaches to come in through our volunteer program. So they're coming in with badges, we know who they are, and they can come in and be with that person and activate them very quickly. So we really tried to make improvements in the things that you're asking for.
And we're also looking for additional peer recovery coaches to support us in our CLEAR initiative, as well as ORP. And Nicole, we'd love to see you submit an application because it sounds like you're already doing that. And we'd love to have you.
Are you?
Yeah. Great, excellent. Recovery coaches, very good.
Steve?
Tammy, if I may, because one of it could certainly be the barriers, because to defense of the hospitals and the physicians and whatnot, as you go through the legislature, you'll see that there are barriers for them where they're not allowed sometimes because of a law or privacy or whatever. And even with the Narcan things, we had to allow the access, and the law had to change for that. So sometimes, and I would have never known that, but in talking with situations like here, you then learn that, you then try and get a bill changed. But also the issue of is the whole issue of awareness. And I just take one quick second to talk about, I don't think we have talked yet about parents. And I tell you, one of the key things is the role of a parent, because the thing we find out the most is, believe it or not, our children don't want to disappoint us. So when our parents are involved and they know, they don't want to disappoint us. And I've talked to a number, and I'll stop and I'll have more points later, but I kept hearing from people that were addicted and in recovery. They wanted to get clean. They just didn't, and they kept using because they didn't want to be sick anymore. They just didn't want to be sick anymore. And I always ask, when did it start? And a parent or a child said, you know what? It started when I was allowed to go to a sleepover party where there was drinking 12, 13 years old. And when they say, well, what made you stop? Sometimes it's because I didn't want to disappoint my mom or dad. Or why didn't you go? I didn't want to disappoint my mom and dad. So the awareness of parents, you play a critical role.
Yeah, good point, Steve. I had a question here.
Hi, actually, it's a comment. I'm Mary Ellen Levine, and I'm with the New Jersey State Nurses Association and a practicing nurse. Something that I became aware of in talking about social media, especially, and was really disheartening to me, was listening to New Jersey 101.5 one day when Dennis and Judy were speaking, and Judy went on quite fervently that she did not believe that addiction was a disease, that she felt it was a choice. She was really pigeonholing all addiction into that moment where someone puts a pill or takes a drink as a choice. And immediately I thought I needed to respond, and I really didn't feel in a position to be able to do it in a way that would really serve the addiction population at that point. So I just turn that over to you because I think, especially as advocates for the addiction population, that was a huge platform. They've got a huge following all over New Jersey, and she was going on, and no one was calling in to counteract that. And I really felt at a loss to be able to do that appropriately. So I just bring that to your attention, especially today, during this month.
When I heard that too.
Thank you for sharing that.
And and, you know, fortunately, the Surgeon General and the American Medical Association and the National Institute of Drug Abuse and scientists and a lot of people in the medical field totally disagree with her. And so, but that sort of, but you're right, where, you know, when you hear that happening, and there's that moment of, oh, should I say something, or am I in the right place to say something? Like, I know what that feels like, where it's like you feel, sometimes we feel alone in this fight, and we have to realize that we're not. Like, there are opportunities, like right now, when we need to be making this, we need to, you know, shout it from the mountaintops or through the megaphones, right? Like but because of the shame that's associated with addiction, and because of whatever your profession might be, we question whether we're the right person to speak out. And I go back to what I said when I was speaking earlier, that everybody in here has a story, and so like when you're ready to start speaking out, like you can be the person up here next year, or you know, like that's it. And so if you can speak to this from a medical standpoint, like you can, for you as a nurse, and you're talking about being a nurse too, and I have a lot of respect for nurses and police officers in this fight, because they see the ugliest side of this all day long. And so when they see the hope piece, when somebody gets well, or they save somebody from Narcan, and they get hooked up with a recovery coach, and then they see that person in the community 6 months later and they're healthy, like that's, we can celebrate that too. You know, so I have a lot of respect for people who are witnessing the worst parts of this all day, in their professions, and are put in a place that we have to be a part of the solution to it. But I recognize that, like, that's why there's a stigma. And, you know, like, there's a stigma with people in recovery. There's a stigma with law enforcement. There's a stigma with people that work in hospitals. Because we see the consequences of untreated addiction all the time. And that's all you read about in the newspaper, right? Like, we see that part of it. That part's not hiding. The piece that needs to come out of the shadows is the recovery and people talking about it. And that's what this is about.
And that's always helpful. Thank you.
Just real quick, just with regard to that, and sort of, it goes back to my changing the dialogue, and we have to be willing to speak about it and come out. And if you start talking about it now, you may not be able to change her. There are other people on 101.5 I've heard that are very promotive of the recovery and what's going on. But we have to be willing to speak out to them. And as the senator said, with our families, you know, the center has a thing, they give out a cup, have dinner with your kid. I've been a proponent of that my entire life, where you have to sit down with your children and watch them. Not just know what your children are doing, know who your children's friends are. And the most important thing is to know who your children's friends' parents are. What do they allow to happen? And be willing to speak with them. Be willing to give that dialogue of what needs to be done. You know, being able to change what's happening, because if we can change the attitude of the next generation, of our children, and they continue that, within 2 generations, we will eliminate most of this stigma. It will be able to change it. We have to start at a grassroots level and be willing to speak out and change the attitudes towards our young. Thank you.
Very quickly, many other diseases and illnesses start with lifestyle choices. Many.
Yeah.
Very true.
Some forms of diabetes, even some forms of cancer, hypertension, some forms of heart disease. All start with lifestyle choices coupled with genetics, environmental factors, et cetera, et cetera. And that is a talking point, I think, that we can all hold on to. If you do believe addiction is a disease, but you hear people say they made a choice, they deserve to die. Now, every life is worth saving.
Can
I also just say one thing? If we're going to ask children, if we're going to ask children to like come to us and talk to us, and we're going to ask parents to respond, parents need to know what to say, because that response, if we're saying it's a disease and it's a sickness, and then there's punitive action and not a sweeping up of that child or that person and offering help, then who would want to come out? Who would want to say I need help if the help isn't help?
Right. Okay. Yes, I am 5 generations Sussex County.
my daughter gave me permission to stand here. She's not in Sussex County right now, but I think there's probably people in this audience that know my daughter, Melanie. Born, raised, planned. She had first mental health when she was a child. My father was Bob Hardin, placed on lithium, the first one in the state of New Jersey. And lithium is sea salt. If my father had lived after he passed away of a diabetic coma at 50, I'm telling you, our whole Sussex County would be different. My point is what you were saying, genetics. 50% of people with mental health are being subjected to opioids. And why do these opioids do very well with people with mental health? Raises the serotonin levels in them. When my daughter had her third nervous breakdown, Newton Hospital, I was promised that she would be placed in a safe environment with medical attention, but at that time in 2013, there is no step-down unit for mental health. She was placed at 96 Main Street, the worst drug, heroin place, and we all knew about it for 20 years. We turned our backs. And 39 High Street. She actually called me up when she saw your prosecutor saying, "Mom, did you see what happened? How are the Deckers next door?" My question to you, Mr. Orho, and my father loved you. When are we going to get the landlord law? We have that, the state grooming board law.
Yeah.
And I believe if we actually speak to the owner of that place, why don't we make that the step down place from Newton so we could have, so they can come there, because he's collecting $300 a week by state funds.
You bring up,
There's no law to protect any of the people that are in there. And my daughter in 2012 said to me, and I was 2 streets away, and I'm on the Health and Wellness Committee at Newton High School, I might add, and that they were talking about high sugar in the school. Nobody was talking about heroin. And when my daughter said to me, "Mom, there's heroin in here." Do you know what I said to her? "Oh, come on. You're being dramatic." But I followed the state law because they said you have to call her homeless, Mrs. Kitchell. But my daughter doesn't have a child or a husband or this, and there's no place. Where does my crazy Mary Tyler Moore daughter going to? You end up with a partner, and then when you're on medication, it's not like a diabetes. When you go off of your insulin, that first 8 hours, you can wander into the woods and everybody gets it. When you go off of your medication, it takes 3 to 4 weeks. It's like a slow tsunami. But a mom knows. And then all of a sudden, she might start hearing something, or she might start feeling something, or she might be paranoid, and then she doesn't sleep for 5 days. That's, please, I'm begging you, pass something with that state.
you bring up a very good point, because interesting enough, with the Newton Police Department, was Chief Richards still here?
Yeah.
Yeah.
He does a great job, right? And let me tell you, and here's where the laws have to change, and unfortunately, there's the process of getting them changed. The Chief Richards and some of his professionals came to talk to us in the office. There is they call it the Animal House, law, but it doesn't cover, and it's a definition, and it doesn't cover the situation. So the police department had very little, ability to change anything. We sent down to the Department of Community Affairs and everything, the stack of all the calls and so this. So what we had to do was change the definition and include it in so that they had police powers. Here's the process where it is through. We put it in 2 sessions ago. We got it through the Senate. We have bipartisan support. It was Senator Rice, myself was the prime sponsor, Senator Rice, and Senator Cunningham. There was actually opposition to changing that. It was tough to get it through the Senate. I think where it stands right now, it's past the Senate. I think it's in the General Assembly, and we're working to get it past the General Assembly. And then we got to get it to the governor's desk. I know this governor would sign it, hoping that the next governor, whoever that may be, will sign it as well. But we do have it through the Senate, and to me, it's a no-brainer. But it really started with the Newton Police Department and the prosecutor's office coming and talking to us that this is the law specific. And you said, thank you. And that's quite frankly how it works. How it works. The problem being is making sure that the because you got 40 senators and 80 assembly people, and you got to get a majority. And unfortunately, it was not an overwhelming in the Senate. We had to do a lot of work to educate people to get it through. And one of the key things we did, it was the data, showing them the data, and showing what the police department did not have the ability to do, and working with Senator Rice and Senator Cunningham, who did a fantastic job in her caucus, we were able to get it through, and that's what we need to have done. Obviously, in both houses. I was going to look this morning as to where it is in the assembly. Do you know? Has it passed the assembly? It's still in committee, right? I'll check the
Maybe
status.
you can get back to one another. I had a question over here, I think. Did I see a hand over this way? Wait, did you have a hand up?
Yeah. I'm in recovery and I'm on drug court. And I don't like the word drug court because people look at it like it's a bad thing. It's not. I like to think of it as recovery court because there's people that care.
That's a good point.
I mean, it might be probation officers, the judge, everything. You know, people look at that as people that are in charge and they have all the powers. But you know what? The people care. Sorry. In the center gives me the opportunity to come here and do that. And I would have sat in prison and I would have got out and I would have right back to what I was doing. Without drug court giving me the opportunity to get clean and have a life.
It's an easy one.
I'm passionate about something now. Instead of waking up every day miserable, wishing I was dead, I wake up every day praying to God, thank you for everything I have. And without drug court, the center, the people that are in the meetings that care, it's just an opportunity that's unbelievable.
Lisa Frisbee, school counselor. I think the motion that this issue is taking is really important judicially in moving towards restorative practices and medically in going to the disease model. But a piece that we're really missing, that we're not supporting this shift in, is in the schools. In the schools, any substance abuse issues are reported on our EVVR, which is our violence and vandalism report, which means that that goes into a number that gets reported and labels a school a violent and a dangerous district. We need to be able to work with students in a supportive way and not have that number be something that works against the restorative practices and the medical model that's being used in very productively in society now.
Tammy, if I could just address it, and that's a very good point, because everybody thinks there's a law that has to change. So that's probably all we have to do is have something change a regulation
Just
of
take
what
that
Move it somewhere else.
I appreciate that, but just so everybody knows, if it's whether it be a regulation in the professionals that you're dealing with this every day, when you if you're able to let us know, is it part of the regulation, the reporting you got to do? So that sounds like a regulation that we should be able to, something like that should be able to change pretty quickly.
Thank you. Thank you. I had a question back here.
Hi, the reason I'm here today is I am a property owner by one of these boarding houses in Newton. I've had to explain to my children things that an 8-year-old should never know.
Yep.
I understand that we have this going to the assembly and that what do we do in the meantime? You know, like we are calling the police, we are taking pictures, we are doing everything, but if everyone's hands are tied, what do we do as homeowners to get maybe more help into 96 Main? Maybe have it so our children don't have to walk by a known drug house on their way to the middle school. I think accessibility is a little bit too easy right now in Newton. The police are doing everything they possibly can, but yet we've had another overdose in one of these boarding houses recently. And it's like, why isn't this Herb Fraser, the man that owns these boarding houses, why isn't he being held more accountable? You know, the manager that takes care of the house that I live across from does nothing. Nothing. She's, you know, does the whole, I'm not aware of what's, I didn't know this car was parked here for a month. I walk past it 6 times a day, but I had no idea it was there. What do we do to, you know, move on, to make, you know, our properties, you know, retain their, you know, their value, and not have 10 police cars outside of your house 6 times in a week? You know, I am a big fan of recovery. Like a lot of people in my family are there. I'm not here to like say that 96 Main is, you know, they need help in there.
That's right.
Please help us.
Thank you, thank you. Yes, George.
I know.
Before I handed it over to Christine, I'm not going to this time.
I think maybe, is this on that topic? Because I think maybe Aaron wanted to.
Just to respond.
Oh, is it a different
Yeah.
topic? I didn't see your hand.
That's all right. No,
Go
I mean,
ahead.
she asked a question, and I think I'm sure we're up here thinking about answers. But I mean, and so I wasn't specifically the one that wanted to respond, but I can. I mean, because I remember when you walked in, and you know, you were like one of the first ones in here, and you said, "Hi, I'm a concerned citizen," and like that's it. Like that, we want the people, like not. And it's great that you had finished up. It's like you're all about recovery, and it's about, and that's important. You know, we need, and it's the whole what can we do right now. And I know, and unfortunately, sometimes obviously the legislative process can take a long time. There are bills for regulation of recovery homes, different homes, and they're. So it's advocacy is to me. I mean, that's my world, and so it's like when I. My sort of answer to that is join the advocacy team that meets here once a month. And Katie can talk to people about that. We have these little purple pamphlets, so whoever wants to start putting their, you know, like to put their story out there and to put their concerns out there. The team works on the issues that when the people show up, when neighbors show up and say, this is what is going on and this is what we want to work on, that's the team starts working. And so
I think that's what
and I know that it's incredibly frustrating, and I'm sure that the senator's frustrated too with things that work. And it takes a long time, and some of these changes are going to be generational, but it has to start somewhere where somebody has to have the good idea. And whether that comes through legislatively or through community action, there's a way to do it. And I don't have the answer automatically of like, this is what you should do now, but start with getting together with some other advocates. And just with the piece on the hospitals, there's a hospital in Patterson that they just stopped giving out opiates. They're just like, it's like you get Tylenol, all right? You're in pain, you get Tylenol. And like, that's what I mean by generational change, where it's like somebody has to start the practices somewhere, and so we have, and this community response we all do together. So.
I'm going to ask
Just one question on that, because the thing, until we get the police powers that they're able to use, there's a couple things, and some of which have already happened. And I think the New Jersey Herald, I think, ran a big story on that art, and quite frankly, that art, that sometimes sunshine is a very good thing, and we were able to use that article in order to go down and convince other legislators, because quite frankly, as I said, we got to get to 21 in the Senate, we got to get to 41 in the Assembly, and it's got to get through the committee first, right? But that's one of the key things. So the issue of the sunlight on there. The other thing that we're looking at for that is the whole issue, and Francis had mentioned to me, is the issue of the business registration. I mean, is there a way of revoking licenses or certifications or whatever? And that's actually part of it.
Okay, thank you. I'm going to move here, but give it back to you.
Yeah, thank you. This may throw a little cold water, and that's not what I meant to do, because I'm very compassionate of everything here. But we gotta do some math. I know that the governor wants to have $200 million, but when you take a look at how much a bed costs, and then the problem becomes is that at 90 days, let's say it's $1,000, that's $19,000. $500 a day would be $45,000. I'm a freeholder. Carl Lazzaro's a freeholder, and people come to us every single week, every meeting, and say, we can't handle the tax burden. So where is the money going to come from? I know that we say no stigma. I know that we say we have to throw everything at it. But where is the limit? I spent 20 years in construction, and for years I built schools. And I watched through 1999 through 2005, there was hundreds of millions of dollars to build schools. And at the end of that period, we built some schools, but the money ran out, and the schools are still falling apart. How do we avoid that happening with this problem? How do we avoid a blowout of money, and now we're sitting there, we have a problem, but we have no money. That's what my concern is how do we control what we're doing here? And I'm not saying this, I'm not trying to put anybody on the spot, but it's something that I've lived through in another area. But I do want to say, everybody here is a taxpayer in one way or the other. Remember, if it's being paid through the insurance company, it comes back as insurance premium. If it's being paid through your taxes, it comes back through your taxes. You know, they say, I remember it was the saying back in the 60s, we met the enemy and the enemy is us. It all comes back to us. We can't throw unlimited resources because we don't have unlimited resources. And many people here are volunteers, and those people I respect very much. But everybody has to eat. So the employees of the county, the employees of the state, the employees of the prosecutor's office, everybody has to be paid someplace. So as we say, we have to throw all the resources at it. How do we get through to people on a level that doesn't cost us hundreds of millions of dollars?
I think one of the answers to one, and that's a very good point, because it's not unlimited resources. However, we got to be smart with the resources we have. Like, for example, the incarceration, right? The issue of recovery in incarceration, on average $13,000 less if we have somebody in recovery outside of incarceration than inside of incarceration. So that's one issue, right? So there's how we do it smarter. The $200 million that the governor had is quite frankly is not additional. It is actually going with the budget and saying, okay, there's the resources that are already there and being reallocated within existing programs that sit there and say, okay, this program obviously is working better. So let's put it into that. So they went through and looked at the $200 million into 21 or 25, how many different initiatives. So sometimes, and without a doubt, if you take a look at, I'm a CPA and a certified financial planner, you look at the resources that come in, I will guarantee you that money that's spent can be spent a lot smarter. And I think that's one of the big issues, is make sure it's spent wisely and effectively, other than just throw it at the wall and see what sticks.
Yeah, I mean, and that's where, so I can try to help out with the math problem too. And it's you're thinking about the amount of money that we're putting in it right now, and when you look at prevention and recovery and treatment, we're thinking about bringing down the cost of untreated addiction, right? It is expensive for the same person to be going in and out of the ER, in and out of the ER, in and out of the ER over a lifetime than to get that person help and have them start giving back to the community and give them a shot at recovery. And so there's like funding prevention, treatment, and recovery support can bring down those.
Just real quickly on that as well. It's the $200 million, it's funding going in, and we're trying to change it. And to the analogy of a building, the most expensive part of a building is doing the framing and the foundation. That's where we are. Yep. We're doing that, and we have to start somewhere. It is expensive, but we're going to make the overall outcome is less people in prison, less people having thefts, less things being stolen from your merchants. It's going to be seen. It's going to be a future, but we have to start, and we have to get people on that road to recovery. And I think it will be less expensive in the future. Once recovery, like everyone here who said that they're in recovery, we all clapped. We have to get used to doing that. Because if everyone does that, people, I think recovery will become easier for them because they're going to get the support of everyone. And that'll be that next step. So recovery will be cheaper in the future. It is expensive now.
Just 5 seconds, just very quickly, because one thing, but at the same time, as far as, spending resources, best, we're going after the dealers. Quite frankly, the incarceration for people who are in recovery, no, let's get them the help they need. But the dealers, the whole issue of the weight as opposed to the units is a big issue. But we're going after those dealers.
Yeah. And that's where Brimage guidelines come in, which are huge.
Okay, just so you know, we will be out of here at 11 o'clock, so
Oh.
I am going to rush you through a little bit just so that everyone gets a chance to speak.
My name is Austin Neary. I'm from Green Township, and I'm a concerned citizen. But I do want to thank everyone on the panel for putting in the effort to do this and informing us today. Aaron, I applaud you for 14 years of recovery. And I also want to thank law enforcement because you have a really tough job now. You've got to do law enforcement, but you're also a source of saving people. So I commend all of you guys for what you do. However, my questions are, doctor, your chart scared me. I see a source out in eastern New Jersey, and I see the effect out here in Sussex County. I see opioid disposition from physicians in our location as being higher than anywhere else. And so the question is, and this is rhetorical, what are you guys doing about it? And it's rhetorical, because I know you're going to do something, but let's do it. The second thing to the prosecutor, Francis, is that we talked about spikes in deaths because of opioids, and I'm sure it's related to the synthetic opioids.
Fentanyl, yes.
So in this case, another rhetorical question is, what are we doing about this, and how do we separate prescription drugs from Chinese imported fentanyl, and do you have the power and authority to do anything to stop this? And then finally to the legislator, to Senator Steve, is that I applaud you guys from going from a 30-day disposition of drugs down to 5-day disposition of drugs, and I think that will really stop it. And I think going forward, if we were to forecast, will the death rate in New Jersey stop because of some of these programs you put in? I believe they will. However, the one thing that you did, and it was basically a catalyst for what I was going to ask anyway, is we're talking about drug dealers. So I'm empathetic to everyone who is in drug treatment, everyone who's a victim of drugs, because it is tough. But the drug dealers, I hope we're not too empathetic with them, and that we have the power to enforce it. And it's something I saw this morning, that there was a drug bust in Camden. It was probably the biggest one, 14 kilos of fentanyl. And this person, the alleged drug dealer, and I'll say alleged at this point, apparently he's not in prison. He's in some sort of pre-trial drug prevention. So how did this person, who had the ability to kill half of the population of New Jersey, is back on the street today? So again, a lot of my questions are rhetorical, and I'm not trying to down the support of how to solve the epidemic. But I also want to make sure that we're not soft on drug dealers, and we're still strong enough to say that let's say no to drugs first, and then let's help the people that were victims of the inability to be able to say no.
Good.
Thank you.
I can respond somewhat to that. With regards to drug dealers, and I said Brimage guidelines have to do with a person who's found for a first time. There are certain limitations of what we can do if that's when they get caught. Unfortunately, with the mobility of individuals, large heroin dealers or large fentanyl dealers, I can tell you they're not sitting here in Sussex County. They're in other areas, and you're able to get it, and it's too cheap. And it's able to come here. So that's what we're fighting. The fentanyl, as you said, the fentanyl is incredibly dangerous, and that's why we try, when it comes out, I try to do press releases on it. And unfortunately, as Rachel said, the brain gets hijacked. And, we had cases where we had overdoses, we had Narcan deployments, we had an overdose death, and after the police left, someone in that same building did the same thing. It shows how hijacked their minds are. It's not because they want to get high, it's because they're dying in their own body and they're striving for it. We are doing everything we can with regards to dealers. That is something that we cannot take lightly, because that is something that needs to be stopped, because if we can stop that supply. And the connection between opioids and fentanyl and heroin, there's a direct connection. Hydrocodone, I have the numbers down below. I got it from the DEA. I'm not exactly sure what year it is. but it talks about the percentage of per country of how much hydrocodone is prescribed. The second highest country in the world is Canada. And then that year they did 100 pounds, or 100 kilos, I'm sorry. The United States had 79,800 kilos. We prescribe and consume about 99% of the world's hydrocodone. That's got to be part of the change, and it is happening. Doctors were sold that this was the greatest thing in the world. One of the things I always talk about is that little pain chart, and it's a simple one. People can point to it, made it easy. Everybody points to 7 or 8. I have news for you. You should be lost the limit 7 or 8. But that's what people point to, and doctors are required because that's what the person is saying they're having. So we need to change that educationally as well so that the drugs are not given out that easily. You talked about the dentist. My son had a tooth that was growing in his bone, so he had to have it removed. The doctor and my sons, God bless them, my sons and my daughter, they have to go through all the conversations I've had being a prosecutor for the years. But they have an understanding of it. He gave him a 10-day subscription to hydrocodone, and I told him I didn't want it. He said he's going to need it. So he did look like he got beat up by Muhammad Ali for about 5 rounds, and he came home, and so he took one. 8 hours had gone by. He came to me and said, Dad, we got to do something else. It made me feel too good. We've talked about it. I can't have another.
Well, good
Never
for
had
him.
another. But that's only because I've had the education. I'm able to give it to him, and that's what we need to share.
Thank you. Yes.
Can I comment on that?
Yes.
There's a lot of things that the physicians are doing, especially in New Jersey, especially at our hospital. I can tell you from my own personal practice, I probably prescribe 85% less narcotics than I did before this law was passed. But it also has to come with a lot of education, because there is a societal
demand
that no pain is tolerable, and as much as we want people to be satisfied with their care, we want them to be happy, because a lot of times in our hospital, the 2 biggest complaints that I get as a director: wait times, pain control.
Yeah.
Okay, and that was before the law passed. So you can imagine what it's like now. So there's a lot of education done on the ground level in the emergency department as far as, this is what we're willing to do. Okay, we have alternate types of pain programs in the emergency department. We have people playing guitar. We have music therapy. We have greater education on nerve blocks. We use more alternate medications than opiates. So there's a lot being done, and we also will partner with those family practitioners in the area who are writing these medicines, and we can tell now that there's not to say this is the right answer, but I can tell you that it must be hitting them hard too, because one, to renew your CDS in the state, you have to attest that you signed up for the prescription monitoring program, and 2, we're getting a lot more people in the ED saying, my family doctor won't fill my pain medicine, so now I'm here. So by seeing that increase, that uptick in people showing up like that, we can tell that people are getting a lot more hesitant to continue behaviors that have been very much propagated in the past.
Thank you.
Question here?
Hi, I'm Valerie Quinn from the Hoboken Municipal Alliance. We're looking for $22 million. I think we need to follow the drug dealers, starting with Big Pharma and their reps. They come into the doctor's offices and they have the ads on TV, and they're spending billions on telling me that I cannot walk out the door without going to my doctor and demanding, ask your doctor about it because I need this. And then the list, I think Boyz II Men sings about the list in the pharmacy of side effects, which is gonna cause me to have to take 2 or 3 more drugs. Because now I have all these other things going on. So is there initiative to calm down this advertising that gets people believing they must go to the doctors, they must walk out with a prescription of any kind, and then I'm coming back next week because now I have all these side effects? there anything worth,
Yeah, it's probably more federal with the FDA. That's where it will come, because all those drugs are regulated by the federal drugs, just like with alcohol and the advertising. Yeah, yeah.
You can't pick up a pen in the doctor's office without it being from a pharmacy or a pad or, anything. The calendar on the wall, the calendar when you sign in.
That's beyond that.
You know the reps are there, and they're trying to get, trips to Hawaii, and, I have a couple girlfriends that are reps, and they have nice cars. They have really nice cars.
Well, they've cracked down on that because physicians now don't get those kind of perks like they used to. I mean, they used to send people for cigar bars and trips to Hawaii and big dinners, and right now it's very, very difficult to do that. So that's why the ad dollars are targeting more of the patient population and not as much as the physicians themselves. I can tell you that we don't allow any drug reps in the ED.
And like I said before, as far as social media, I don't know if you were here when I said that about sharing our message, and we don't have those budgets, but grassroots level movement is huge. That's how the AIDS epidemic was addressed. It was from grassroots people saying we're not going to, and educating kids, and from the ground up. We do a lot of that in Sussex County.
Well, I only have 5 minutes left. I know I also had another freeholder who asked to speak.
I'll be very brief because the more I talk, the more trouble I'll get myself into. I've been involved in the drug field since 1960s. What you're seeing today was predicted and was done back in the 60s. I ran a residential treatment center. Thank you very much for your comments, Dr. Brudico. You hit it right on the nail. Do we have any parents in here?
Oh, yeah.
Please, this is your problem, not $200 million. Put the damn cell phones down and have dinner with your children.
I beg to differ with you. I think that parents...
Let him finish, please. Let him finish, please. I have to be
The one thing that nobody wants to talk about is values. This whole thing centers around values. And we have allowed the family structure to be beat to death. We need to restore those families. We need to put cell phones down. We need to have dinner together during the week. We need parents to sit down and talk with their children. When the kids win the tournament at the end of the season and get a trophy and all get accolades and go back to the parents' home and have a party with a keg of beer, that's a parental problem. And we need to take more active role as parents. I raised 4 children. Thank God they're all doing well and none of them had a drug problem. One of them had anorexia. And that was a disease that happened in the school, and it was just as rampant as anything else. We need to take, and nobody wants to talk about the word values. Values are the key to this. Drug addiction's a fight, is it not? You don't get out of this problem as easy as you got into it. Am I correct?
That's a little too broad of a question.
No, it's not broad. You can walk into this problem very easily. You've heard everybody say it. I got it in my cabinet. I got it in my house. I can get high anytime I want. But to get out of it is a fight. You have to stand up and fight for yourself and make yourself come out of this. This is not something that you just pass by or get another med. This whole thing started in the 50s with the Excedrin commercial. Take a pill and you'll feel better. And we started the pill generation in the 50s, and it's gravitated and graduated up here. The prevention that has to take place in the schools and in the homes and around the values that we have as people and what we expect for our children is where we need to put the effort and stop all the other stuff. This is our problem. You don't flog this with $200 million and make it better.
Well, one thing, one comment, and I know Anne-Marie wants to respond.
Anne-Marie was first.
I just want to say, if all the parents in the room that have drug-addicted children that sat with their children and had dinner, that talked to their children, that were PTA involved, that were Little League coaches, it's not the problem. Sometimes it could be part of it,
Part of the
but
problem.
there are plenty and many good parents who did everything, were home, and it still happens. And by the grace of God, your children were not affected, and perhaps the genetics. But there's a few things that happen, and it isn't the problem.
Okay, I only have a
By
couple
the
more
grace of
minutes
God.
left here. I'm going to take one more question.
By the grace of God, you are. True.
Is Vivitrol a valid treatment?
Vivitrol? So Vivitrol is FDA approved to address both, initially it was for alcohol use disorders and then it was approved for opioid use disorders. Very high promise for individuals to help them reduce cravings and sustain remission.
In Western PA, they have a mobile Vivitrol unit from a former heroin addict. She's been its core. And they go from town to town to town, like Sussex, where they wanted to put a methadone clinic. And a lot of the neighbors are against it, but I think Vivitrol is something to be, to think about.
Absolutely. We
And
hope
I-
that there's going to be additional funding for it, and that's just
And,
excellent.
and that would go to all the rural areas, and it's just a shot once a month, that maybe you need it after 20 days, but
Right.
it fluctuates, and then you can go to work and you can operate, and your body can heal, both mind and body.
Yes. Yes, I think it's content. I have.
Okay, thank you. We do have to close. It is 11 o'clock. I do want to take the time to ask you now, there are surveys on your seats, to please fill them out, and you can leave them on your way out. Where should they leave them? At the door there, on the way out? Okay. And I want to thank all of our panelists for all
Can I
of
say
your
one thing?
participation.
Just one thing.
To all of